provide them. So non-invasive options we have with Evoke. Evoke has a cheek applicator that treats basically about 4 by 2 inches of the double chin area, if you will. And so for mild to moderate cases, you can use that device in a non-invasive way once a week for 6 weeks, about 45 minutes of treatment session to get a result. Works very well. Provided the skin laxity is not significant, provided the amount of bulk in the neck is not significant. So if you step it up and you need to take care of a larger fatty area or there's more skin laxity, then we have to add something in addition to that Evoke treatment, something minimally invasive. And what combination of things can we then talk about and provide for a client? So for the 30s, 40s, 50s, depending on skin laxity, how much fat there is, we can do something pretty novel, pretty clever. It's called the Zoom lift. Isn't that fitting? So it's a suture suspension technique done through a series of 2 millimeter openings. And so why is 2 millimeters important? Well, if you don't make that 2 millimeter opening larger, it won't leave a visible scar. And nobody wants a visible scar. So we can tighten the whole neck area and decrease the double chin, take care of the bands in the neck, the grimace muscles, if you will. And that can be done with the Zoom lift. Now, what's important is what you add to that treatment. So if you want to tighten someone's cheek tissue, if you want to tighten the zones of the neck, I can add FaceTite to it. FaceTite's a bipolar radio frequency treatment. Think of an electrified pair of tweezers, one limb of the tweezer under the skin, one above the skin. Use a little ultrasound gel to protect the skin, and it tightens that entire fibroseptal network, shrinks it down. Get rid of pre-jowl areas, tighten the neck skin. If you still have skin laxity or crepiness, once all of that's done and everything's closed, we'll go over it and we'll do microneedling. So microneedling can be done with Fractora or Morpheus 8. And when you're numb, you want me to go ahead and bring everything out of the toy box and take care of that for you. So those combinations will give you basically a non-surgical neck lift. Now, the person who has too much skin laxity, too much bulk in their neck, may in fact want a surgical neck lift. Now, I don't do isolated neck lifts. I do them with lower third face lifts or full face lifts. So we want to treat the whole facial aesthetic as a unit. We don't want to have asymmetry between areas. So if we treat a neck, we'll treat the lower third. I do those as face and neck lifts under local in the office or in combination with the Zoom lift at the end of a face neck lift. That way you get a better, sharper angle. So you can decrease the downtime of a facelift by adding the Zoom lift to it at the end by not opening the neck, just keeping the neck closed and tightening it with the Zoom lift. So in summary, there's 3 ways to take care of a neck now. If in fact you want a non-invasive approach, use Evoke with our chin applicator once a week for 6 weeks. If you want a minimally invasive approach, I'll curate the proper techniques for you to get the best response, either with the Zoom lift and FaceTite, or combinations of microneedling. And of course, if I feel like it's beyond that, we'll discuss options that are surgical, like a mini lift or a full facelift. So to learn more, please go to my website, drrobertwhitfield.com, to look at videos, before and afters, and always look at the show notes.